Hello everyone, my name is Gary Mahon and I'm a Director of Enovation, and I'm joined today by Maeve Coleman, who is a lecturer and teaching fellow at the Technological University of Dublin. And we're here today to tell you a bit about a project that we had the pleasure of working on, I guess, earlier in the pandemic, back in May, when we were invited to provide some support to the health service during the pandemic, essentially for training their staff in how to work effectively remotely. It was a great example of industry and academia coming together for, I suppose, the common good, I guess, in some ways, to help out in these extraordinary times. So I'll just give you a little bit of background on Enovation and a few of the milestones from a certification and partnership perspective. Enovation have been partners with Moodle since 2004 and 2009 in France. We also work with Tutara, another related product to Moodle, which we became partners and platinum partners in 2017. We set up a company in France in 2018, so we have an office there based in Bordeaux, and we're growing our team over in France. And very importantly from us and from the perspective of many of our customers, we achieved ISO 27001 certification in 2019 for our information security management systems. And finally, this year, we became Moodle Premium Certified Partners and offer workplace services to the market because of this, I guess, achieving this level of certification. So our offices are, as I say, Dublin is our head office, France, Bordeaux. We also have back office functions in Poland, and we have recently started an office in the US to service the US market and our customers over there. Our markets predominantly are Europe. We have clients in Africa, some in Asia, and the US. And to date, we have more than 300 customers across all sectors: higher education, further education, corporate, government, and obviously transnational and not-for-profit organizations. So really our customer base is across all sectors because e-learning is important to all these sectors. So I'm going to introduce now Maeve to talk to you a bit more about the actual project and what we did and the work that Maeve and her team did on this project. Okay, Maeve?
Thanks, Gary. Hi, everyone. So it's my great pleasure to speak to you about our CPD certificate in remote working, which was very, very quickly deployed through an industry, academia and government collaboration. And it's often very difficult to gain the partnerships necessary for this kind of triple helix project. But we were responding to an absolutely huge unrecognized training need, and we provided really large amounts of sectoral impact during the first wave of the pandemic, that between May and June, using online learning and very much facilitated by Enovation. I guess if we roll back 6 months and look at the learning need that preempted this project, in Ireland, tens of thousands of workers were suddenly sent to work from home. Through the module, we were able to find out that 66% of them were unprepared by any previous experience or training in remote work. And that meant that we were correct in perceiving this massive need. And it was a need to develop awareness of the context and skills around this new remote working type. And we very much termed this as emergency remote working. It wasn't the normal remote working that organizations had been used to deploying in the past. There were very much some specific needs around that. And so we needed to examine the technologies and tools that are used in that, identify for learners those challenges and benefits around this emergency remote working, and learn from what people had done in their deployment of remote working in the past. Probably most importantly of all, and a key difference that started to emerge, was our focus on well-being and employee support. In being sent home, there was a confusion around the requirements of remote working and also an extra stress. And so our aim through the module was to be a source of well-being knowledge and to help people to work effectively as remote workers via a sustainable model, a more sustainable model than just being in that emergency mode. But first we needed a platform, and this was absolutely key to the deployment of the project. And I'm going to ask Gary to just provide a quick overview of the Moodle deployment that we were able to use.
Yeah. We understood that there was going to be a high volume of users and quite high concurrency, because the plan behind the program was that we would get it done, get as many people trained as possible within a short time frame. So we built a highly available platform in a public cloud environment. We spec'd it for the high numbers of users with the high concurrency. Importantly, it had to be easy to use, so it needed to be themed so that the users could find the training easily. And for this, we deployed Moodle 3.8. We also included the H5P authoring tools, which Maeve will go into in a bit more detail in a minute. And we provided and managed all of this for free, because it was our way of helping out in these troubling times. And we provided support, technical support to Maeve and her team down in TU Dublin to make sure and ensure the success of this program. So I'm going to hand you back to Maeve, and I'm going to turn off my video until the end of the presentation.
Thanks, Gary. So I can't stress the fact that if we weren't able to avail of this technological solution, the project would never have happened in the same way. The project started out as a very humble solution to try and help people providing information to remote workers who'd been sent home. And again, as Gary pointed out, there were tens of thousands in the health sector who were sent home and who needed this information. But with this technological solution and having, I suppose, teased out the learning need, we were able to use a H5P plugin on the Moodle platform. And this formed an absolutely ideal structure. We were quickly able to deploy 26 interactive multimedia artifacts and assemble them in a storyboard to provide that video instruction and interactive assessment. And this is another key area where we were able to turn our remote working course into a professional continuous professional development certificate that was accredited by TU Dublin. It's because of the assessment tools and H5P interactions that we were able to harness. And what we found that as we assembled the multimedia artifacts and as learners went through the program, the platform saved learners time and reduced the cognitive burden of a normal e-learning deployment. It enabled self-paced learning, and we also built in regular support, regular live support. And one of the ways in which we did this was to use the Microsoft Teams plugin, which the organization, one of the largest organizations that undertook the module, had implemented just recently to deal with the pandemic itself. So it was all very smoothly deployed in that Moodle platform. From a learning perspective, the module had 5 sections: an introduction, which brought learners up to speed with the requirements and the types of technology that they would be using. The second part dealt with basic level information on issues like health and safety, GDPR, virtual communications, and the practical aspects of remote learning during the COVID-19 emergency. And this was fully accessed using the H5P technology. In particular, it used the interactive video and course presentation tools from H5P Suite. In the third section, we asked several key experts to come in and discuss specific aspects of remote working with them. We were able to have John Reardon, one of the directors in Shopify in Ireland, who have 100% remote work deployment, to come in and talk about organization and time management for remote working. Dr. Niamh Imbush from TU Dublin came to discuss specific aspects of well-being for remote work. And finally, Renata Coleman from Grow Remote, a community-based organisation that supports remote workers, came to speak about teamwork and team structures. In the fourth section, we saw the real assessment power of both H5P, Moodle, and the learning plan come to fruition. This was the main assessment area of the course and enabled and unlocked hundreds of thousands of further investment in CPD certificates from TU Dublin to be released into the health sector. The course used structured reflective questions to develop a remote work charter for all learners. It was specific to the health sector and also instructed remote workers who were deployed quickly into a remote working environment on the basics of ergonomics using an interactive H5P tool. And these assessments were mandatory parts of the CPD in this section, so they did have to be used by all learners. So I'm just going to go through a brief look and feel. So in our module introduction, a brief example of introducing the H5P, showing people how this worked in the course presentation tool. We provided a good level of instructional design around how to use them and showed interactive lead-in exercises in order to maximize the learning. Again, the predominant tool that we used was interactive video with course presentation deployment, but this is another example of a drag and drop functionality about cyber attacks and cyber security that we implemented as part of the safe working from home section. We also were very, very aware that the challenges for remote working and also time management are key issues, because many people, when they're learning about this subject matter, have problems with actually implementing them and I suppose being disciplined. So we used drag and drop functionality and also an accordion tool to show people you know, very simple ways of being able to discern through your time management and priorities, and also be prepared for the common challenges of remote working. And those elements were quite successful. As I pointed out with our setup for success section, we did use H5P documentation tool initially and replace that by the Moodle survey plugin 1 week in. But what was extremely successful and extremely popular was an interactive H5P slider image. And this was used to improve home-based ergonomic setups. So it was, I guess, a replaceable slider image that showed you a number of home ergonomic hacks that you could use quite easily. We can see on the left of screen the official HSE ergonomics image, and on the right the hacked home image, which does exactly the same thing with without the cost or overhead or having to access the office. So people found this really, really effective in terms of their learning. Finally, we had a motivational section called Onwards and Upwards. And here learners received a really special message from an Irish Olympian and well-being speaker called David Gillick, who was an amazing addition to the module. He speaks about resilience and healthy eating and well-being, and it was amazing to have David on board to give people a lift that they needed in a time of confusion and in a time where they were facing a lot of uncertainty. He spoke about dealing with uncertainty quite extensively, and that really helped. Again, this wasn't an assessed element, it was something that really lifted the tone of the module overall. So I want to also talk about how fast learners were going through this module. So I'm a lecturer with about a decade of experience in higher education institutes all around the world. And there is a certain rhythm to face-to-face modules. We have a semester and we have a weekly plan. And for a normal module like this, we would expect that it would take some time to get to understand the concepts. And one of the things we were completely taken aback by was how fast learners could integrate these lessons from the H5P technology. And although it's only a theory and I don't have much evidence about it, I'm pretty sure this was because of the interactive video tools that we used for simultaneous instruction and assessment. And I think that's the key. We also supported them using a checklist plugin on Moodle, and this was absolutely tailored to the need of the CPD certificate. So there were plenty of additional information and resources available, but the checklist made sure that learners could self-identify and self-control their completion. And what happened using this combination was a fast-track learning process. So we also found through our YouTube, because in using the videos, we served them from YouTube unlisted platform into the Moodle H5P environment. And we found that people tended not to learn at weekends. It was very clearly Monday and Tuesday were the very busiest days. And it's a clear pattern that happened throughout the 2-month deployment of the learning module. What we did notice as well was that there were several styles of learning. There was a get it done ASAP. They interacted early and they completed fast. They demonstrated very high levels of interaction with the materials and included things like the extra and additional reading over and above the basic points of the platform. Another type was the start, stop, and start again. Off to a great start, but may have struggled in terms of work-life, work-learning balance. Stumbled perhaps at the assessment stage, but then with the deadline of the completion of the project in early June, started and completed again quickly afterwards. And then we have the last minute people, Indiana Jones and his hat, and they registered early but then finished late using our learner management reminders and learner management support. So what I'd like to say, this was a fully deployed e-learning environment which was completely self-directed. We did actually provide a full support desk structure via TU Dublin, and this was using our fabulous student interns Jamie, Victoria and Natasha, who helped at all stages to manage inward and outward management for learners in the module. Inward emails were managed with a daily intake of 50 to 100, and these were on topics like registration, but also learning support and curriculum questions. What we noted was there was very few about the technology itself. Okay, so there's the subject matter, subject specific rather than technology emails. And we used outward emails to identify and manage learners at risk of dropping out. Moodle was essential in this process. Our development of processes quite quickly around who was working and moving through the modules using a variety of different metrics that were specifically enabled through the Moodle environment. And as I said, I can't stress highly enough that none of this would have been possible at all without that donation by the Enovation team to this. We provided twice weekly online support sessions which were live, and this created a really and truly wonderful sense of community for everybody. There were a mixture of drop-in sessions, we hosted speakers in them, and it created a truly, truly wonderful sense of community amongst the learners. Despite the fact that there were thousands of people registered on this, everyone felt important. Everyone felt like they were part of something that would support them through this remote working challenge. And that's specifically one of the things that we set out to do. Which is why I can't stress enough the importance of tone. And tone was developed through a range of technological and people-based actions throughout the project. It was instrumental. And just to highlight a few of those that were important to our journey on this project. We didn't want to make this too lofty or too academic. We didn't want to make it about reading journals and writing essays. And that's one of the reasons why we had incredible success in our inclusivity. We had people who were just about to retire. We had people who never finished school. We had people who were going through issues in their lives and they found our module and our project to have helped them through. And this was because we didn't take a loftier academic tone with any of the resources. It was very practical. It was based around learners' needs at that time, but quite robust in the background in terms of academic theory. What we wanted to also take was learners in their emergency remote work capacity. Okay, so we wanted to speak to people even in the deliberate recording of videos in our kitchens, in our living rooms. And in fact, I have a folder of feedback which says and describes this as contributing to the inclusivity of the module. Because people said they felt like for the first time they were doing okay. That because they had children or pets or people to look after in their emergency remote working capacity, that we were doing it too. So it legitimized their experience. And this was extremely important to them. And they noticed it, even though we had done it quite deliberately, they noticed it and fed back in emails that were quite positive. And finally, we did support learners with regular community sessions online. We didn't leave it all in the e-learning self-directed mode. We really made an effort twice weekly to check in with people and allow them to check in with us and with each other. People recommended the course to friends, to teams, and entire departments, in fact, and it was identified that you could spot people who'd undertaken this course through the way that they had now changed and approached their remote work. So there was an incredible impact for our project. So just to point out some of that impact, we had 2,500 approximately learners enrolled, of which 1,000 qualified for the CPD in remote work. And not everybody wanted the CPD certificate, but we did have incredible impact on that course. So I just want to point out that they may have gone on to further and in terms of enhancing their digital literacy. At this point, I'll pass over to Gary to summarise our project and to finalise our presentation for today.
Thanks, Maeve. Thank you very much. That was very interesting. As Maeve said, it's been an extremely successful programme, and I think it opened the eyes of a lot of the senior management within the health service in Ireland as what is possible online. A lot of this was new to everyone involved from their side. I think also both ourselves and TU Dublin were very proud to have been able to do something during these times. It was great to have the opportunity. And while our role, keeping the technology going and everything else, really the heavy lifting was done by Maeve and her team. So it's a great credit to them, because I think they put in some extremely long hours in providing support to the users, many of which, as Maeve said, had no prior experience of working on systems like this, and it was all new to them. So one of the great takeaways is that a lot of them feel empowered to go on and learn other things, and the HSE themselves have been looking at other programs to help enhance the digital literacy of their workers, which is, you know, it's a great outcome really, and a great tribute to the team who brought this program. So thank you very much for listening, and thank you again, Maeve, for helping out and for delivering this presentation. Thank you.